Now, part of why games are so important for us to pay attention to is looking at the statistics here. So a lot of people are thinking, I don't really play games. I don't know very many professionals who play games. We don't need these right now. But if you think about your medical student community or the students who will be arriving soon, and you look at how virtual worlds are being used in the age group that's moving up towards us. So there's these statistics, this was the best graphic I could find, but the statistics are actually way bigger than this now. This was second quarter '08. So Habbo hit over 100 million, I think it was about a month and a half ago. There's probably 200 million avatars for teens and adolescents in virtual worlds. And that's, you know, not like totally dominating the whole universe, but I went to my son's school and was doing a presentation a couple of years ago at I guess last year at middle school. And when I asked how many of them were using Gaia, which is one of the virtual worlds, it's not one of the major ones even that you see here, 75% of the hands in that room went up. Now this is not a research sample, but it was like I walked into one classroom of 7th graders in one school in Ann Arbor, and 75% of them were like, oh yeah, I'm there. And the teacher was going, I had no idea. I have to learn about this. I have to know more about this. So their teacher was going, oh, is there a way I can use that? And I'm going, they're coming here. How long will it take us to become comfortable in virtual worlds so that we know what we can and can't do and how to work with them to engage with this community that is rapidly approaching? Okay, moving on, it's not just teens who are using virtual worlds. One of the surprising things that's happened with Second Life is the really rich engagement by seniors. People over the age of 45 would fall in that category as far as how they're keeping metrics for Linden Labs and Second Life. And I wanted to just point out these two different resources that we're looking at metrics from a couple different points of time, but all of them pointing out the surprising influence in the over 45 community. One of the things that's really interesting is the over 45 community, as you can see, doesn't have the most avatars, but they're spending the most time. So there's a surprising growth in that community, and that when you are looking at Second Life and the number of hours spent engaging with it, what happens is the biggest slice of the pie, the 39% age 25 to 34, they just tend to spend like 6 to 10 hours a month. You know, it's like they pop in, go to a party with their friends, pop out, go to their real life, run around, you know, do whatever it is they're doing. So they're not spending a lot of time there. Whereas the over 45 group is spending in excess of 60 hours in comparison. So you're looking at the amount of hours they spend online in the virtual worlds is this incredible number of hours. So they tend to dominate the actual metrics of how many people are there at a given point in time. Some of the things going on, this is a screenshot from my collection of health images for Second Life, and I'm seeing, let's see, well, here's medical simulations. Here's a giant model of the testicle showing spermatogenesis, and they fly the students through the model and explain things. This was a funeral for one of the early healthcare advocates in Second Life who had died unexpectedly, and there was this enormous upwelling of support and community. They have models of hospitals, They have information conduits. They have this little maze here is a stress relief thing that, you know, I was at one of the cathedrals and they had this same labyrinth etched into their floor that you would walk the labyrinth as a meditation and a prayer, and they've replicated that as a stress relief space in Second Life. Let's see. Ability Commons was a grant-funded project that I assisted with. There's disaster simulations, just this really rich range of educational and outreach activities that are happening in this space. And I tell people, if you only look at one thing about the concept of serious games, this taxonomy is what you should be looking at. They do a great job of painting an overview of ways in which gaming is being used for social change and, you know, advocacy types outcomes. Okay, another thing that happened that month, now I changed these slides, and you should be grateful, because when I originally gave this presentation, I thought, oh, I'm talking to medical librarians, and I put, they won't have a problem with any of this, and I just grabbed things that interested me. And the medical librarians were like, ugh. So I replaced the images on these slides with things I thought probably more appropriate for a general audience. But Henry Ford, here in Michigan, rah-rah, is doing twittering of surgeries. And they've done several of these now, and they're absolutely fascinating. And they do questions and answers with their Twitter audience while it's going on. You can send them a question, and they will send you back an answer. So you see the bottom one is showing the Q&A. They're using this as consumer outreach, consumer health education. My daughter is one of those people who's went through a period of time of being addicted to watching surgical videos on late night cable television. And it just baffled me. I'm like, I'm the medical librarian, she's the tattoo artist, and she's sitting there glued to the screen watching these surgical videos and giggling. I'm going, I think it takes a special kind of person to spend a lot of time watching the late night surgical videos on cable television. And I don't think it's necessarily a good way to reach the general population. But looking at alternative ways, I think Twitter is a nice intervening way that you can put the word out, but people don't have to look at the pictures. And they can ask you questions, and it's going on real time while it's really happening. It's not captured and shown to you later. You're not deciding so much what's important for them, but you can kind of correct midstream. If they go, well, I don't understand why you did X, Y, Z, you can get an answer. Or I'm curious why you made that decision. What was the information that led you to decide that for the patient? Or how did you work this out? And I think it's this really interactive, really dynamic way of getting the education out. And they did enrich it. This is a screen capture of part of the discussion from the search stream so that you could track it and see other people dialoguing with them and sending them questions and commenting on what was happening. And they also would pop in, they were capturing video during it, and they would pop the video over to YouTube while the surgery was going on. It was not a real-time feed. They would capture the video, then put it in, but it was happening while the surgery was going on. So they'd talk about it, and then they'd show you, and if you wanted to go there, you could, but it was totally optional. They'd always let you know, and you'd have to click through to the link.